A new year, a new decade, maybe a new you. The list of resolutions can get lengthy. As part of To Your Wellbeing, we're focusing on how all of us can plan for a healthy year.
Yeah, so Dr. Zoe Stallings, who practices at Primary Care Pomona in Greensboro, is joining us today. Thank you so much for joining us.
Thank you for
that practice is a part of the Cone Health Medical Group. So we want to just dive right into this, Dr. Stallings. You know, you're saying that we should be, leaning on doctors when it comes to maybe setting resolutions, especially if it has to do with health.
Absolutely. We want to partner with you. And so many times when people make these goals, we want to sit with you and look at what things could be a barrier. Look at your family history, screen you for certain things, and actually be a good checkpoint along the way. Let's say you're starting a fitness plan or a boot camp. Let's do your cholesterol panel, screening for diabetes before you start so that you can see your progress. Partnering with your doctor also gives you like a check-in person. And this person is going to look out for your best interests. So if you're overextending yourself or you have an injury along the way, we help you get right back into your goals.
And as we're talking, we want you at home to join the conversation. You're going to see that question there at the bottom of your screen, our interactive question asking you today, how do you plan to make 2020 a healthier year? So you can use the Vote Now feature in the News 2 app and let us know what you're thinking. So let's talk family history here. What information is key?
So we want to know, are there any risk factors for heart disease? So do you have several uncles who've had problems with apnea, meaning that they choke and seem like they can't breathe when they sleep? We could screen you earlier. We want to know that maybe if there's some asthma, because we want to help you pick the right workout for you. We also want to know, is there thyroid disease? If you are working out, nothing is coming off, the weight is sticking, let's check your thyroid. If you're just so tired you can't really get up to exercise, let's see if you have anemia. If all your aunts and uncles and everyone else is anemic, let's check and see if you are at risk as well. You know, my favorite brother, he always talks about his workout and we talk about the different things we do together. When he struggles, I start to think, maybe it's in the family.
Right.
So it's important to check on that.
And sometimes you hit a plateau and you don't know why, and you think you're doing the right thing all the time, and your family history really is working against you.
Very true.
So you talked about family history and also checking in with you, making appointments, but there's another factor to think about as well.
Right. It's so important along the way to have balance. You know, many times we bite off a little more than we can chew. And so it's very important that we budget our time. We budget our money, but budget your time as well. Factor in for those moments when you just want to take care of yourself. We tend to live in the margins. We're exhausted often, and you can't lose weight if you're not sleeping. You really can't lose weight if you're overworked. So we try to create a space. And as your primary care provider, I often ask people, tell me about what your stresses are, because stress holds you back in so many ways.
And mental health is an important aspect here, too.
Huge part. And at conehealth.com, you can check out classes about balance. You can also look into groups. And many times people even can go there and get some counseling and therapy as well. It's very important to look at the whole person.
And there's really just so many resources available at your fingertips that sometimes you just don't know about until you take that step into the office.
Exactly, exactly.
All righty. Well, thank you so much for your help and your advice. Go and see a doctor. It's good for you.
And let's check in our results. You see, most people are saying that they plan to exercise more, so that's always a good one. We'll be right back.